in this space, because most people that are listening to this are wellness minded at some extent. But we forget about our vision health.
Right.
Like I said, until they have a problem and then we have to come see you. But there are benefits for exercise for your eye health in general.
Also with exercise, there's a lot of literature that supports that eye pressure is lowered with exercise.
Okay.
So glaucoma. Let's say you've got a borderline pressure. There's nothing wrong with exercise. Exercise will make it better.
Yeah, that makes sense.
It's just moving around, and the eye is basically there's fluid made inside. There's drainage. If you're moving and you're active and you're healthy, it's gonna lower the eye pressure.
Yeah.
A low eye pressure is a very good thing.
A low eye pressure.
Yeah.
Okay.
Very much.
Yeah. Very good. That's great information.
And whenever I check a low eye pressure, it's usually somebody who's running, who does a lot of exercise. Because I always say, you get an eye pressure like 10 or 9, you're going, what do you do? Because that's odd.
Low.
And they'll tell you they run 5 miles a day. It always, the lower it is, it's usually a sign of good physical health.
Okay.
And sometimes I'm always amazed at a low eye pressure. I'll say, and usually you'll ask the question and they'll say they do a lot of running, or they're like a marathon runner, or
they're in really active shape.
Active shape.
Yeah.
And that's something I've noticed for years.
Is that something with the eye pressure? Is that something that somebody can change, like with lifestyle modifications, like if they have?
Well, there's eye drops that'll do it, but.
Peter Vergos, how are you?
I'm doing fine.
Good. You guys, this is Dr. Peter Vergos. I'm here in his exam room.
Exactly,
right? Yeah, so I'm here. Thank you so much for allowing me to come have this conversation with you.
Okay.
Yeah, is this your first podcast, YouTube?
It is my first time on camera.
Okay.
I'm going to do my best for you.
Great.
I feel like I've got a lot of good things to talk about. I think eye care is very important to people.
Yes.
And, we're coming up on certain seasons now where red eyes, and everybody's got questions about blue light filters, and they've got questions about nutrition, and I know Pam's involved in a lot of that stuff, so I think this would be a very good podcast for her people to see. Yeah,
all my listeners, definitely eye health is something I don't think we even really think about a whole lot until we can't see.
Okay. Yeah, for sure.
So Dr. Vergos, I want you to tell us just a little bit about yourself. I like my listeners to kind of get to know you just for a minute. First of all, I just say, "Here's my eye doctor," okay?
Right.
But what's the difference? There's a couple different kinds of eye doctors. So what,
Yeah, so initially when I was in the profession, I've been doing it for 32, 33 years. Most people thought the optometrist is a place where you go to get glasses and contact lenses. Over the past, during my career, things have changed now, and optometry now is the primary gatekeeper, I believe, of eye care. If you we've got the ability to diagnose disease, we can treat glaucoma, I take metal out of people's eyes. There's a lot of things that have changed over time. And then if needed, we do have a lot of referrals that we do during the week, and we have, and ophthalmology is pretty much the people that do, we have an ophthalmologist that does surgery for us. We have one that does retina for us. We have eyelid people that we use. So I always feel it's I'm the perfect person to see initially first, and if there are problems, I'll definitely get you to the right spot. Yeah, and it's been a wonderful way to make a living. I've enjoyed it for 33 years, and I've had many patients of mine that have become eye doctors. So I'm a very big advocate for optometry. I got initially involved with optometry. My father was in the restaurant business, and one of the things I like about optometry is that there is a retail side to the business where you're selling glasses and contact lenses, but also the stuff that happens in the exam room, the medical side of it. So it gives you a good mix of being a businessman and also being a doctor. Yeah. And I've enjoyed it for a long time.
Yeah, that makes sense. And you like to have those conversations with people. You're very personable with people.
I appreciate that.
Yeah, and everybody likes to talk to you. I even talked to Matt, my husband. I'm sure you guys all know that. We know Dr. Vergos and his wife, his family, very well. Quick background. Dr. Vergos came to train with me when I was about probably midway into my personal training career in person. You guys know I don't do that a whole lot anymore, in-person training. But he trained with me for a long time, and he was one of few guys amongst groups of girls that he would come train every day. And then I got the pleasure to train his wife as well at different times, because typically husbands and wives don't train well together.
We did a lot together, but yeah, it was fine.
So that's kind of how I got to know Dr. Vergos, and then he's taking care of me and my family, my kids, all of our eye health needs. So that's kind of how I know him, and we know him through the community, just very nice guy, very lovely family. So
I appreciate that.
yeah, so that's a good point to talk about your profession and the different kind of sides of it, because that's something else we don't think about either.
Exactly.
Because we kind of lump doctors together sometimes.
Yeah, exactly.
Yeah.
I love the profession so much that even my son Nicholas he'll be an eye doctor in a year, so he goes to school in Kentucky. And currently, I have 3 other patients of mine that are in optometry school. I have a boy from Davison, a boy from Powers that goes to school in Florida, and I have a girl from Kersley High School. She's in Memphis.
That's
so I've got
awesome.
4 more eye doctors that were patients that sat in this room. So I'm very proud of it.
That is very awesome. Yeah, I'm very
Very
proud for you, because that's something like kind of part of your legacy that you want to leave behind and say, hey, you know what?
Yeah, I'm always open. If somebody has questions, I don't mind people shadowing me, and I think of all the times that I've been shadowed, and then I'm writing a letter for them to go to optometry school, and the next thing I know, they're competing against me out there for Genesee County's eye dollars, where people are spending for eye care. So it's been good.
Yeah, and you're like, bring it. It's fine. I've been here. There's enough to share.
Yeah. I'm kind of glad that Pam did this today, because I think we're headed into a time where the phone is going to start ringing next week. With all the parents that think their kids have pink eye.
Yeah. So that's what we wanted to start with.
Let's talk about pink eye, because this is going to be. There's so many things that there's basically 5 questions that I can ask you, and 95% of the time I'll know what's going on without even checking the child. First of all, with pink eye, pink eye always happens in one eye first, and then the child would transfer to the other eye. Okay. Now we're headed into a seasonal allergies right now in April, and we also get them in late August. And an allergy is going to happen bilaterally. It's going to happen in both eyes at the same time. And with an allergy, kids will complain about their eyes itching, and we do get a lot of watering. With pink eye, we usually get a discharge that's watery, but it's more of a burning sensation, and it's usually one eye gets it and then the other eye gets it. And then we also have to figure out between a virus, an allergy, and then a bacteria. A bacterial infection in the eye will have discharge of color, so it'll either be green, white, and that's usually from a child touching something dirty, and then touching it to their eye. So a discharge is bacterial. A viral red eye, like you would have with pink eye, is one eye first and then another eye second, and then an allergy eye is one where you get bilaterally, and that's where we're coming up right now. And there's a lot of over-the-counter eye drops that you can use for those type of things. But usually with those questions, I can pretty much determine what's going on.
Yeah.
And always, the number one way to really know for sure is to have the patient in the chair.
Yeah.
We can look at the eyelid, and the eyelid will tell us a lot of what it exactly is.
Oh, okay. I know I've messaged you many times, like,
Yeah,
look at a picture of my kid's eye.
Yeah. Well, now you know. If it's in one eye and then goes to the other eye, it's virus.
Yeah.
And then you also know if it's bacterial, it's going to have a colored discharge. And then if it's an allergy, it's going to be bilaterally, it's going to itch, and it's going to run water.
Makes sense.
If you know those 3 things, you can at least go to your pediatrician if you weren't coming here and just say, one eye, the right eye got it and the left eye got it. And the pediatrician or whoever you're at is going to know exactly what to do.
That makes sense. Ask the right questions.
Ask the right questions, And a lot of people, when I sit their child down and start asking questions, go, wow, what's he getting at? And before I'm even done, I already know what it is.
Yeah.
And you put them behind the equipment, and you've pretty much made the diagnosis already. But, the thing with viruses is that I've found that, a virus, like if you get it in your eye, it's the same like if you get it in your body. It has to take its course. The difficulty that we have is when somebody comes into the office and they have a viral problem, everybody wants to be doing something actively to get rid of it.
Sure.
So this is one of the few times that you do, I'll usually prescribe an eye drop, with a little antibiotic and maybe a little steroid. And it's really not doing, it makes it feel better, but it's not really making it, go away.
Go shorter.
Yeah, a virus has to work through your body.
Yeah.
But in this, in Genesee County and most of the eye doctors that I associate with, we still prescribe something even though we know it's just got to run its course.
Yeah.
So.
Well, it makes probably, like you said, the eye feel better, and maybe it's a little bit of placebo, like.
You're doing something actively, and then also with a little steroid in, there's going to make the eye look less red. Yeah. And you feel like you're getting better, and basically what's making you get better is just the duration of having it.
Yeah. Okay. Yeah, I think that's worked every time. Every time my kids have something, I just give them the eye drops, and they're better, quickly. So maybe some of the things that they can do to, obviously allergies, is that something allergy, but for the other ones, is there anything they can do, like parents, we can do?
Just, they always talk about hand washing and just, but everybody's going to run into things. People say, I think the best thing we can do is if you suspect a pink eye, is don't send the child to school.
Yeah.
Keep them out of the classroom. Kids cough on each other. They put their hands to their. So it's inevitable. It's going to happen in your building. Immunity.
My kids call it doo-doo eye.
Yeah. Exactly. I got it. Yeah. Had a lot of that in my family too.
Okay. So it's funny. So on to, I guess we can go in from what else we talked about before we jumped on. Were kind of some of the things we wanted to discuss. The pink eye, definitely some great information there. Some of the preventative things you can do, and then what to tell your doctor and what questions to ask.
Right.
And the next thing is a big hot topic when it comes to eye health is blue light. Okay. And even this ring light that's behind us here, making us look so great. So blue light in general, that's a big question. I guess you had some things you wanted to talk about. I wanted to see if you could discuss some of the things, blue light, and it pertains to maybe brain health, your sleep cycle, hormones, that kind of thing. Yeah. And then ways to help blue light. I know you have a lot to say about blue light.
Well, as far as blue light goes, the number one source of blue light is the sun. So, of course, sunglasses and things like that is important. But
should you wear sunglasses all the time? Because I've heard some mixed things, like you should not wear them a little bit in the morning because of the circadian rhythm, or is that kind of true, or should you wear them all the time to protect your eyes?
I think if you're outside and it's, I think it's a good idea to wear sunglasses.
Like sunscreen kind of thing.
And the thing about it, Pam, the blue light became a real hot topic when all the kids during the pandemic got tablets.
Yeah.
Okay.
Yeah.
So you've got the sunlight, and now all of a sudden your 6-year-old has a tablet.
In your face all the time.
Right. And there's blue light coming off of that.
Yeah.
And then all of a sudden, let's say they go to become 12 years old and they get their first iPhone.
Yeah.
And then all of a sudden they're 18 years old and they've got a computer class, and they're finding that all those bombardments of blue light are causing problems later on. Okay. Like macular degeneration, things like that. Mm-hmm. All those things lead.
So what is that macular degeneration?
It's a problem you don't want.
Mm-hmm.
And
can you break down real simple for us to know?
Just a breakdown of the retina.
Okay.
Okay. And with macular degeneration, a lot of it depends on color and your skin color. So like my parents are both Greek. Darker skinned people are less likely to get macular degeneration compared to somebody who's lighter skinned, like Irish, Dutch, German, Scandinavian. Mm-hmm. So, whenever we talk about blue light, I'm very, if I see somebody very fair skinned, I talk about it more.
Okay.
Okay.
Even like eye color, you've mentioned to me before.
Yeah,
like
blue eyes. Yeah, blue eyes more so than brown. And there's so they've done a lot of studies on blue light and how it you were talking about like your rhythms and your biorhythms and all that stuff. And they've actually one of the contact lens companies right now has come out with a blue light contact. Okay. They're actually touting that the contact lets you, if you wear it during the day, that you sleep longer during the night because blue light suppresses melatonin. Melatonin is what keeps you sleeping at night. So. Yeah. They're
that's
finding
hormone.
It's just a naturally, in your body that keeps you sleeping.
Yes.
So, so there's a lot of literature like that out there. With all the screen time, also, besides blue light, is nobody blinks anymore in this country.
Yeah.
30 years ago, the average
I just
American,
blinked when he said that.
Yeah, exactly. So 30 years.
I bet everybody else did too.
Yeah, exactly. Because the average blink rate in America was 18 to 20 times a minute. 30 years ago, we're down to 6. So there's a lot more dry eye.
Yeah. See, those are things we don't think about.
Right. Nobody thinks about blinking at the computer, but in theory, if you're a woman that's, premenopausal, or you're a guy whose testosterone will be coming down and all those hormones are not what they were when you were younger, then all of a sudden your eyes do become dry. And that's why you see a lot of the commercials on TV right now. You've got the Zidra and the Restasis and all these different commercials for dry eye.
Okay.
And a lot of those drops are ones that we use when people go through those stages in life, and all of a sudden their tear layer is what it wasn't, and now they've got a computer job and they're not blinking, and it
Are there certain medications with side effects too, like that people are taking that can cause more dry eye?
Yeah. Well, blood pressure medication can cause it. There's other, a lot of medications do cause dry eye.
Yeah.
So you combine that with the screen time and not blinking. Yeah. It seems like eye doctors just keeping busier and busier.
Yeah, we're just keeping busy.
Yeah, exactly. And so it's worked. And the other thing what we're noticing is that there's a lot more nearsightedness with nowadays. And what happens is for the first time in their career, we have parents that have had perfect vision, and their kids come in and they can't even see across the room.
Oh, wow.
And what's happening there is it's being caused by what they're doing. So if you sit there and look at your phone all day long or look at a screen all day long, the eye is flat when you look far away, the lens in the eye, and when you go to look up close, it stretches like this. And if you're doing only close things, and you look across the room and the eye doesn't want to go back and forth, it gets stuck seeing here. So all of a sudden, usually if your parents have good vision, the children should have pretty good vision. Genetically, yeah. But more so now we're seeing more of an environmental component because everybody's spending so much time up here.
Yeah, that
So,
makes sense.
so a lot more glasses being prescribed for far away and things like that.
That was another question I was going to ask you, was have you seen a difference? So yeah, you've seen a difference in eye health in general over the generations, just from
for sure.
screens.
And I've been doing it 33 years, and we are noticing a lot more myopia, which is you can't see across the room.
Okay.
And it's because of all,
Yeah, so I guess that could bring to the next question, what's the safest way to view the screens? Because you've talked about that. He's kind of educated. So when you come see Dr. Vergos, he will educate you on different things, and even with your children. So that's something, he's very realist to say, you know what, we have screens. We're going to have screens. We're going to have screens for the rest of our lives. They're going to get worse.
Yeah, that's the thing is when you're in the room with a parent, they want to say, no more phone. You never want to say that.
Yeah. So what's the safest way, I guess? Because I
always say good posture, maybe some light on behind you. You don't want to get too close to anything.
Because that's something my kids even remember. You've told them in here. Especially Blake, my 9-year-old, he'll say, we got to turn the light on behind us.
Yeah,
when we have our screen on. So they know, they actually just know they'll turn the light on if they're going to have a screen. They don't sit in the dark with their screen, and they try not to sit too close.
Yeah, that's refreshing. Somebody's listening to me.
Yes, my kids, you have made a difference, and that will, trickle down. But they remember that Dr. Vergos said those things to them, and they want to have good eye health.
And the other thing is, let's say for somebody like Blake, if he's on the computer or something, there's nothing wrong with getting a pair of blue light glasses.
Okay, so those are beneficial?
Yeah, they're over on Amazon. I'll even say to people, you don't have to get them here, but I mean, if there's no prescription and they're worried about screens and how that affects the health of the eyes, there's a lot of studies that are still going to be done over and over.
Yeah, might as well use the protection
it's
we have right now.
Yeah. You can get them over. They just wear them when they're on the
It's
screen.
one of those modifiable risk factors.
Yeah, exactly.
That you can just grab a pair of blue light blockers and call it good, and just not going to hurt anything.
Exactly.
Yeah. So that's good. So that's a little bit of healthy screen time if you're going to do it. I know you said you hate to give recommendations, but you obviously don't want your kids sitting on the screen all day, or yourself as an adult. So how often would you suggest, like if somebody has an office job, or maybe your kids are learning online, how often would you maybe suggest to take a break and go look at something else or play a sport or something?
I love that idea. Because a lot of times, what they were recommending with screens was, at least if you're on a screen and your eyes are dry, shut your eyes, and they want you to look in different meridians, up, down, sideways, and the eye will relubricate and maybe make it more comfortable as the day goes on. It's hard to say, if you've got a job, 8-hour job, and I have patients all the time saying I'm 8 to 10 hours a day on the computer. It just sounds like cruel and unusual punishment, you know what I mean?
My brain explodes when somebody says that.
Right, I know, I just
do that.
Really, 8 to 10 hours, no lunch or anything, but so,
So like if you have to do that, would you say like maybe, because I mean,
just take a break.
From an exercise standpoint, if somebody for me says I have an office job for 8 to 10 hours, I'm going to say, well, maybe every hour or so, get up for 10 minutes, maybe 5 minutes if that's all you have. Go for a quick walk. If you have a small office space, that's all you have. Do a few squats, take some drinks of water or something.
Okay.
So could you do that, you know, would that be recommended too, like for eye health in general, like maybe?
I tell you one thing, I like that.
Yeah.
Get up and do something different.
Yeah, just to look at the different focal points, like you said, might be beneficial
for sure
for the kids too. I would say
also
for
a lot
the
to
kids
be
get
said.
outside.
There's a lot to be said. Like I know you're into supplements and things like that. They're with dry eye, they're also stating right now that fish oil helps.
Okay.
So if you're getting dryness on the computer.
Some omegas.
Some omega-3 things like that. We talk about macular degeneration. They find that people that have a better diet, heavier. If you look at the vitamins that we recommend for macular degeneration, they have lutein in them. Okay. Lutein is found in heavy green vegetables, your kales, your spinaches. So having a good diet, being like a good lifestyle coach like you are, I think helps a lot of people. But eating well, getting exercise, all those things come hand in hand.
So it all matters.
It all matters.
Yeah. And I think, like I said, that's something that I think that we forget about in this space, because most people that are listening to this are wellness minded at some extent. But we forget about our vision health. Right. Like I said, until they have a problem and then we have to come see you. But there are benefits for exercise for your eye health in general.
Also with exercise, there's a lot of literature that supports that eye pressure is lowered with exercise.
Okay.
So glaucoma.
Makes
Let's say
sense.
you've got a borderline pressure. There's nothing wrong with exercise. Exercise will make it better.
Okay.
Yeah,
that makes sense.
It's just moving around, and the eye is basically there's fluid made inside. There's drainage. If you're moving and you're active and you're healthy, it's gonna lower the eye pressure.
Yeah.
A low eye pressure is a very good thing.
A low eye pressure.
Yeah.
Okay.
Very much.
Yeah. Very good. That's great information.
And whenever I check a low eye pressure, it's usually somebody who's running, who does a lot of exercise. Because I always say, you get an eye pressure like 10 or 9, you're going, what do you do? Because that's odd.
That's low.
And they'll tell you they run 5 miles a day. The lower it is, it's usually a sign of good physical health.
Okay.
And sometimes I'm always amazed at a low eye pressure. I'll say, and usually you'll ask the question and they'll say they do a lot of running, or they're like a marathon runner, or
they're in really active shape.
Active shape.
Yeah.
And that's something I've noticed for years.
Is that something with the eye pressure? Is that something that somebody can change, like with lifestyle modifications, like if they have?
Well, there's eye drops that'll do it, but
Well, I mean, as far as like exercise, is there if let's say they just kind of have general not great eye health, maybe some genetics in play, and then some lifestyle modification. If
eye
like
pressure does
exercising,
go down,
can
yes.
you get it down,
Yes,
just
it
like
does.
blood pressure?
Just like blood pressure, exactly.
Okay. Yeah, that makes
nice.
sense.
Gosh.
You
know a lot of stuff.
See,
I didn't realize.
So smart. Hey, I will say that when I do these conversations with anybody, I always do my homework.
Okay.
So I do a lot, not a ton, but I like to know a little bit.
I'm impressed because I was trying to help it along, and I wrote some notes down.
He was trying to dumb it down, y'all.
Yeah. Well, I know that she takes her kids seriously, and she's a a mom first.
Yes.
So I thought
absolutely.
we'd talk about red eyes, and we talk about things like that, and stuff that she's I've taken calls. Eyes are red.
Yeah.
And then the blue light. Everybody's concerned about.
That is a big thing, is the blue light. I think we talked about that. One thing I did want to talk about was pertaining to the kids and even athletics. My son has pretty good vision, and you had mentioned before, and Dr. Vergos likes to make everybody feel really good.
Yeah, I do. I always think it should be positive. But what happens is, everybody asks when should a child have their eyes checked. I usually like to see them at about 1 or 2 years old, and you're going to think, how do you do it? The child, might not be verbal, they might not be able to know their letters and stuff like that. But there's a lot of things, when I was in school, they would say, to do a pediatric exam, you only need 1 or 2 minutes. You need to look at the child. You want to, we do something called retinoscopy where we can determine if the eyes are equal. The whole key to having vision like Blake does is that the eyes are working together.
Yeah.
If you have an eye that's good and an eye that's bad, the brain turns off the bad eye.
Yeah.
Therefore, you won't have depth perception later on. You need, and the thing about having a child checked at 2 years old, if there's something like that going on, we can do patching therapy and different things like that to make the other eye work, and then later on we'll have a better visual outcome, and they'll be able to do sports, and they'll be able to do different things because the eyes work together. The whole key to vision is eyes that work together. And we would be able to determine that on a 1-year-old or a 2-year-old. We might instill, maybe a pair of glasses would help, or patching therapy, or different things like that. So people are always amazed when that come to the front. They've got a 1-year-old, and they say, "Well, do you want to see him before kindergarten?" I said, "No, bring him in right now."
Yeah.
That's the best time because the eye is plastic only till the age of 7.
Oh.
So you've got to do something before that age, and if you come in at 2 years old, you've got more of a chance to have a better outcome.
That makes sense.
Yeah.
I mean, obviously, there's things you can do later, so there's not lots of hope, you guys. But it's best if you catch it.
Catch it earlier.
Yeah.
Yeah, like with most situations.
Yeah. So he talked a little bit about depth perception, and that's something that. So I've had my kids in here since they were tiny because we happen to know Dr. Vergos. So he's like, bring them in. I'm like, okay. And more of a preventative thing to kind of check, and he's always said, man, Blake, you have great depth perception. And he has said, you're going to be great at sports, and it was very true. And he pretty much can pick up a ball, and he can learn any sport, and he's very good at all of them.
And he's into practicing too, so I can see he loves
that
type of
and
stuff.
he and he does play his fair share of video games, but he makes sure he turns the light on behind him.
You know what? Believe it or not, Pam, a lot of the times video games are part of vision therapy.
Don't tell
because
my son that.
If you really think about it, I mean, just think about it. He's looking at a target that moves.
Yes.
Those are all ways that you're training. And a lot of times when I see a kid with great depth perception, they're a gamer.
Yeah.
They're used to dudging depth and shooting.
That might be why he's also so good at video games.
All right, exactly.
I won't tell him that though, because he'll use that to lobby more video games.
Because when I was in school, a lot of the therapies was a video screen and something moving across it, and you touching it or training the body to move with the eyes and things like that. And
But working together, the eyes working together. So my daughter, some of you guys don't know, she has one eye that's she got some nerve swelling. I checked out. We had kind of a scare, but Dr. Vergos' big thing is that, she has glasses. The prescription has changed only because she can see better now, or she can read better now, so
Right.
she's able to give you a better exam.
Yeah. That always
But
helps. Yeah.
every time he says the eyes are working together, so that's
the
really
key. She's gonna have a wonderful visual outcome.
yeah, and so that's a big thing. So if their eyes aren't working together, there's therapies that you can do for that,
sure.
and that also helps with your sports.
Yeah.
And that's kind of where that was too, is kind of from an athletic background.
Most sports teams have a vision therapist.
And they help people to help with their depth perception.
Yeah, I mean, even Kate Cunningham does visual therapy.
Yeah. So it's all part of your health. It's part of your brain health, because that's something I was reading and listening to. Also, is we're all concerned about our body, of course, but aging happens no matter what. There's that's something we can't get away from, and that happens with your eyes and your brain. And for me, going into my mid-40s, brain health and the perimenopause, postmenopause kind of stuff, brain health is very important to me, because I feel like that's one of the worst things to happen, is to have negative effects on your brain. So your eye is so close to your brain, and we don't think about so much. So some of those therapies can help probably.
Yeah, those connections are always there.
Yeah, so that's something I often think about when it comes to reading and depth perception and things like that. But you said that there are like vision therapy.
Oh,
and
there's a lot.
There's certain things that you can do. So we talked about that, and then you talked a little bit about nutrition. What are some? You talked about omegas. Are there in kale and beta carotene?
Yeah. Heavy green.
You said lutein, which is greens, and even tomatoes, brightly colored.
Yeah, for sure.
Things like that. So that's all going to affect.
They find people that get a good diet have less macular degeneration.
Okay.
Things like smoking affect the macula.
Yeah, I wanted to talk about that too. Actually, that's something that Matt said. Bring up smoking, because
smoking affects small blood vessels in your body. The macula is fed with small blood vessels. So if you smoke, you inhibit those. People that get the worst macular degeneration are the ones that are smokers. Okay.
Now, do you find like if somebody quits smoking, is there any way to like help that? Or is that not something that you've really paid attention to? Because we see a reversal even in the heart disease reversal clinic and things like that, and people can get better. Obviously, they've done damage, but obviously you don't want to start.
Right.
That's the first thing. Don't start smoking anything. Don't vape. Don't smoke anything. If you're gonna smoke weed, don't smoke it. Do it another way.
Weed drops eye pressure too.
Yeah.
So it used to, before.
But take a gummy or a candy.
Yeah,
don't
exactly.
Smoke
Yeah.
it.
Before, people would come wanting to lower eye pressure with marijuana.
Yeah.
And
but don't smoke it.
Yeah, don't smoke it.
That's the best thing. Is don't inhale the things.
Right.
There's already enough chemicals in the air.
Yeah, but I'm sure with the not smoking, definitely the macula would have.
You can start. Can you regenerate that? Is that something you can get better, or is it just something that
I'm not sure. Usually with macular degeneration, if there's damage, most of the therapies that we do just keep the damage at where it's at.
Okay, so
it's not like you can improve it again.
Okay.
So I would think just quitting smoking would make sure that where you're at, you stay there.
Doesn't get any worse.
Doesn't get any worse. Yeah.
Well, that does make sense. And you talked about when we should get our first eye exam, and then I think we talked about, have you noticed the difference in general eye health? We talked about that some, and then. Was there anything else that you kind of wanted to go over? Because I'm going through my list here, and
I know I was thinking, nutrition, red eye, we're thinking, like what you're, with your kids and all that stuff.
Yeah, and we talked about exercise, and all of that too, and
it's been fun.
Yeah,
I've enjoyed talking to you.
Yeah, is there anything else that you would want to suggest to somebody in pertaining to their eye health in general?
I like what's happened with, how we keep talking about technology. One of the best technologies that eye doctors have now is like recalling patients. Okay, so I like to see everybody at a year.
Okay, that was my next question.
A year, and with all the new technology we have now, we used to have to take, if we wanted to do a recall, we'd go grab all the files and start calling people and stuff. Now with the press of the button, and for the first time, usually the average eye exam in Genesee County would be like every 23 months. With the advent of technology, we're seeing people every 12 months.
Okay.
Pretty much straight. And it makes it easier on me too, because there's not the, if you see somebody, in 2019 and all of a sudden they're back in 2023, it makes it a little bit more difficult on the eye doctor too. Seeing somebody year after year after year, first of all, you get a flow of information. You know, you can compare year to year, and it's nice to see people at a year, and I love when I see that. You know, I'm in 2023 and I look and it says last eye exam was 2022.
Yeah.
Makes it easier. I'm able to, you know, with all this, with the technology and the, you know, what we were concerned about before, we talk about it. You know, people are always amazed that, you know, that I remember. And basically, it's in the file. You know, it comes up with the electronic record.
You do have a good memory.
Yeah, I do.
Yeah.
I do.
Yeah,
And,
it's part of the personality that goes with the profession.
So I do like seeing people on the year. You know, we do get a lot of people that will be like, "Oh, I saw you 10 years ago," and it's difficult. And
so you're kind of doing damage control at that point if
yeah.
something's going on.
Right.
Yeah. So
exactly.
so consistency over intensity is my motto for working out. So same thing with vision health. Consistency over intensity.
Just stay consistent, and we'll all be happy.
Yeah. I think the last thing I really wanted to touch on that we didn't talk about, I think we both forgot, was the importance of sleep. Obviously. And I used to have a really hard time sleeping years, just anxiety and that kind of thing. So I'm really, really like big on sleep, first of all, for general health. But also my kind of nighttime routine, like all of this, the lights are turned off. We don't have any.
You turn off all the digital?
We watch TV before bed,
okay.
But probably like 20 minutes we won't have any electronics, but in our entire upstairs, we only have salt lamps turned on. We have no electronics in the rooms whatsoever. There's no TVs in bedrooms.
Okay.
I don't even allow iPads in the bedrooms during the daytime because I don't want a habit of that. I need it to be sleep.
So you don't look at your phone in the middle of the night or anything? Good for you.
No, and that's something, the phone is plugged in, it turned off far away from the room or in another room.
Oh, good for you.
But I've had to work for that.
To do it, yes.
Yes, and that is something that I was very diligent about. So that's kind of my environment, like sleep hygiene, I guess is what we call it. Sure. Cool bedroom. So is there anything, like you said with the screens, is there any tips for everybody else that you can think of?
I think you know, like an hour before bed.
An hour before bed, turn everything off.
Like you said, keep everything dark. Don't have the phone next to you. I mean, I'm amazed at, you know, how many times you'll look at your phone and right there you've got blue light.
Does that turn off melatonin? Like
right there. I mean, all of a
away?
sudden now you got to relax again, and you know you turn and you know they say when you look at your phone that it even stimulates hormones that other ones that'll, you know, like more. Not I don't know what they are exactly, but stuff that'll keep you up.
Yeah.
So
sure.
and sleep is very important, and you know
cortisol and your
exactly.
endorphins and things
very
like
good.
that. Yeah. I've gotten smart in my old age.
I swear to God, Pamela.
I used to just be a dumb trainer.
You were never.
Yeah, so I think all of that is really important, and I'm so happy that you came on and had this conversation and let me come in and invade your space. He's off work and he took time for us. Yeah. So thank you so much.
I enjoyed it, and if if anybody has any questions, I mean, I know you're going to put it on Facebook.
I'm going to put it. It'll be on YouTube. It will be on podcasts, Apple Podcasts, Spotify, any listening platforms there are. And then if you guys have any questions, you can leave in the comment for this YouTube, and then I can always get them back to Peter, and we can do another maybe 10-minute session. Come in.
We could just answer questions. Yeah, yes. I don't mind. And maybe I could have misspoke on something. If there's anything you want to add to it.
Yeah.
I'm always listening.
Yeah, for sure. So you did a great job on your first YouTube conversation.
I know my wife's going to be watching this and thinking, oh my God, I know she'll be chuckling. So
no,
say, honey, what are you laughing at? But
you guys, I love his wife.
Married 32 years, so it's got to have a little comedy involved once in a while.
Yes, she's amazing. What an amazing family. Thank you so much, though, for coming on. Is there anything else that you want to leave anybody with?
I think that was good. It's nice to talk to you. I enjoyed it.
Yeah, awesome.
Okay. Right,
well, thank you. Don't forget to like and subscribe, all the things. And if you guys want to find Dr. Vergos and you're in the Genesee County area, I will link up his information up at the bottom here. He's not really on social media a whole lot, but
Lions games,
you know what he is? Dr. Vergos is working, so he's not on social media.
Yeah, exactly.
So. All right, bye. Thanks, guys.